Welcome everybody to this town hall. This is a very timely town hall, and we know that we have, it looks like well over 180 registrants. So welcome everybody to our town hall on the COVID pandemic. I want to, first of all, acknowledge everybody's efforts within our community. The entire School of Veterinary Medicine community and all of its stakeholders have done an incredible job of responding to the pandemic. And I just want to thank everybody. We're learning new ways to operate our educational resources, to our diagnostic lab systems, to all of the research activities that we do so well throughout the year. And including among these is responses to a full range of how we meet societal needs, from our pets, in our hospital, how we respond to that, how we provide information and take care of them during the crisis, to our agriculture and our very important role in food safety. And later today, I'll have a conference with our agriculture and natural resource system related to that. And so, as you can tell from all of the activity and all of the press that's been put out, our researchers are actively involved in solving solutions to the pandemic. You're going to hear more about that in just a few minutes. I think one thing that I'm really very impressed with is how everybody's worked together as teams to get the information out to the public, to working within our colleagues to form new research teams. There are many opportunities that we have to address the problem, including new funding mechanisms, both at the campus level and at the national level. And I know all of our investigators are actively involved in that. So, and you're going to hear some of those later today during the town hall. And so our town hall today is really, we've assimilated experts within the One Health Institute as well as our Primate Center to provide information, and we will be having questions and answers at the end, and we'll probably be using chat initially. And I'm going to turn that over a little bit to our first speaker. So with that, I'd like to introduce and tell you about our lineup today, and then allow them to really take you through what they've been working on. It's quite exciting as well as very timely. So our panelists today include Dr. Jonna Mazet, who should be no stranger to interview. She's our director of our One Health Institute, and she'll provide an overview of the COVID situation in California, but also nationally, as well as some of the global activities. Dr. Tracy Goldstein, outstanding virologist within our One Health Institute laboratory, and she will be talking about the laboratory support for COVID-19 and some of the global patterns of coronavirus diversity that we're seeing. Dr. Brian Bird within our One Health Institute will talk about our host ecology related to COVID, including domestic animal updates as well. Then we have Dr. Kreuder Johnson, our EpiCenter and Disease Dynamics Director, and she'll talk about modeling projections. You've seen a lot about modeling, and she'll talk about that and some of the work within the Epi research highlights. Then we're going to ask Jeff Roberts. Dr. Roberts is at the California National Primate Research Center, and vaccine development is one of the areas that he's going to talk about, and some of the steps that our California National Primate Research Center is taking to protect animals and their caregivers as well. And then finally, we'll finish up with Dr. Trina Smith, who is our director of our One Health Workforce Next Generation program and the One Health Workforce Capacity. And really, this involves a global effort as well, and we're very proud of that recently funded project. So they're each going to share a brief summary of their respective work around COVID-19 response and the future pandemic preventive efforts at the regional, national, and international scale. So thank you all very much. I'd like to thank all of the panelists today, and I'm going to turn this over to Dr. Jonna Mazet, who will take us through and start us off. So thank you.
Great. Thank you so much, Dean Lairmore, and thanks to all of you who have joined us. We're over 300 participants now, so it's clearly, something we're all grappling with our families sheltering in place, worried about loved ones, worried about societal impacts. And so we're really happy to be able to bring you this town hall, and hopefully others of you will follow suit, because we know so many of you are doing amazing things. I really appreciate our amazing community taking your skill sets and immediately adapting them and using them to contribute to knowledge and response, because together we can all get through this and come out better the other side, more prepared, so that we don't have to have this situation again. I'm gonna just share my screen with you now and give you just a little overview. And we'll go into a little bit what's happening globally and in California, but I think from the One Health Institute's perspective, we really want to share with you what we've been doing for over a decade in this space, and what it means for us now and what it tells us. So certainly we've been working on coronaviruses. Coronaviruses have been kind of at the top of our risk list because work by many of the speakers that you're gonna hear from today has shown that, that coronaviruses can jump between species often and have broad species ranges. So while we are concerned about the interfaces and how people are interacting with animals all the way from pristine areas into the markets, we really do have a lot of questions about what the original evolutionary host was for this virus. It's almost certainly a bat, but did that transfer into an intermediate host? Was the market actually the source, or was it a place where people came together, people who were infected and spread the virus? You're seeing lots of almost scientific rumors, slightly supported, like about pangolins being hosts, and certainly it appears that they can be infected with really closely related viruses, but still the most closely related virus, which was supported, the discovery of that was supported also by PREDICT and NIH and others in a collaborative framework, was a bat. So if we just want to kind of think about bats for a second here, I hate to like trick you, bait and switch you into our kind of soapbox here, but we definitely want people to be pro-bat and talking about bats in a positive way. There are multiple reasons for that. One is that the bats are really important to our functioning planet, including being insectivorous, some of them helping to control pests, connecting fragmented landscapes as people divide up landscapes. Seed dispersing bats can certainly travel long distances and connect those fragments for rare and endangered plants, and even in agriculture, promoting pollination. But on top of that, from a more human-centric perspective, bats certainly are not easy to control, and they've been attempted to be controlled in many situations because they can be pests and get overpopulated. So so we really do worry about and think about how you might control infection and transmission between bats and people. But when you cull bats, it's first of all generally unsuccessful. We see immigration from other colonies back into the same niches. We see actually encouragement or facilitation of increased recruitment or higher reproductive rates. And those reproductive periods, especially the weaning periods, tend to be the periods where bats are being infected and shedding virus even more. So, so culling bats is really not a great idea. So that's just the little soapbox, but let's get back to the numbers and what's happening in California. These are numbers as of, well, they came out yesterday for the day before. They're the most accurate number we have now. So almost 17,000 cases in California with 442 fatalities. About 10% of those cases are in our healthcare workers, and I think that's something that we need to keep in mind. They're not all being exposed and getting infected in the healthcare situation, but that is a number we need to protect those healthcare workers and be cognizant of that. I think when we think about the deaths, the numbers of deaths in California are far fewer than in other areas where the virus probably started right around the same time. New York is probably a couple weeks ahead of us, perhaps. But I think even if we dive down deeper into these numbers in San Francisco, which is, if you compare that to New York or LA, it's dramatically better. So we have only, I think, 10 deaths as of yesterday in San Francisco. So for a big city, that's incredible, especially knowing that we started so early. So I guess what I wanted to say there is that we have some hope, and that what you are all doing and what you are encouraging by sheltering in place is really protecting people and our healthcare workers so that we really can get ready. The University of Washington has been projecting how many beds and how many ICU beds specifically we need to get through this crisis. And you can see the dotted purple line are the beds that are needed, and the blue line is potentially ventilators that are needed. And for California, the projections are that we have enough beds. Now that is dependent on us continuing to shelter. And we can talk about what that means and how long that might be as we get into the question and answer period. Please put your questions and answers in that chat box, and we will come to back to you with those questions kind of curated by theme, and read those out and answer them in the pretty extensive Q&A period we have planned. Here's the contrast with the US, and the US is looking like it has a serious bed and ventilator shortage. Again, differences in management by state and even by city really contributing to these issues. Okay. We're going to get through this, but we're facing obstacles. We all know that we don't yet have a vaccine. We're still in the midst of a really big testing crisis. We're starting to see the effects of social isolation, which leads to PTSD and anxiety and depression, and that is going to be another part of this pandemic, an epidemic at least, if not a pandemic of mental health issues. And then people are grappling with how to protect themselves and protect others. And so we see recommendations changing almost daily around transmission and how to protect yourself and others with the growing use of masks that I think we're all advocating when you go into public. In addition to the mental health issues that we're likely to all be grappling with in our own homes, especially as we stay isolated, I think that's additive with our concerns about the economy and also about the workforce. Some of you are out in the workforce providing essential care, especially to animals, and you are our heroes for doing that, but I'm sure for yourself and your family and the people that you manage, you're having to deal with a lot of stress about, should I be working? Should I be out here? Should I be putting people at risk? What about the animals? Are we putting them at risk from us? Are we potentially going to be at risk for them? So there's just a lot of questions that we'll get into a little bit more. One of the things that I've been doing has been able to serve on a new standing committee put together by the National Academies of Science, Engineering, and Medicine based on a request from the White House about 4 weeks ago, about the same time we went into sheltering, to address some of the scientific questions that maybe needed some support from our community. So I've listed here all of the rapid consultations we've already done and provided in writing back to the White House. We can talk about any of these as you go. I've also provided you the link there, but it might be easier just to Google Standing Committee 21st Century Threats, and you'll get it without having to type that big thing in. So you're going to hear about our PREDICT project and what we've been doing for the past decade to be looking forward for these things. And on some level, it's frustrating that we've been talking about these risks for so long, but we haven't been able to see a major shift in behavior. That said, I do believe that the PREDICT project has done an amazing job, and you will hear about some of the things we're continuing to do to really be finding viruses, including over 100 coronaviruses, but training a One Health workforce. Unfortunately, not here as much as in the countries that USAID allowed us to work in lower and middle income countries, but those people are just an amazing workforce that are staffing up laboratories for diagnostics and serving on national task forces to help with infection prevention and control. And then finally, I'm also proud to be a board member and to join with colleagues from the One Health Institute, EcoHealth Alliance, the Bill and Melinda Gates Foundation, the Smithsonian, Nigerian Academy of Sciences, to really be able to start to think about taking the PREDICT project to scale and finding all of the viruses ahead of time and starting to understand the risks around those viruses, which ones are most risky, and whether or not we can develop different diagnostic and vaccine pipelines early, but even more importantly, get our systems ready, as we have helped to a small extent with the other countries, as I mentioned. By doing this work and training folks, you kind of raise the flag about zoonotic disease and help the systems be more nimble and resilient than ours have been so far. So with that, I'd like to hand it over to my colleague, Tracy Goldstein, to take us into the virology a bit more.
Thanks, Jonna. Let me just get my slides going. So good morning, everybody. What I thought I would do is sort of go a little bit back in time, sort of what we were learning and doing before the outbreak, to try to understand what are the zoonotic origins of coronaviruses and where might the risk be. And I think, it's no longer new information, but at the beginning part of the outbreak, I think people didn't really realize that there were other coronaviruses that circulated commonly in people that generally caused mild disease, such as NL63 and 229E. These cause, mild colds. But in 2003, during the SARS coronavirus outbreak, that was really the first time that people thought about this family as a potential concern in terms of public health. And the work that was done afterwards showed that it likely started in animals. And so it really raised the level of this viral family being a zoonotic concern of pandemic potential. And then, of course, MERS coronavirus followed after that, again, linking to animals. And then the recent coronavirus is really bringing that to the forefront. But actually what's really interesting is that almost all coronaviruses have zoonotic or animal origins. And I think that's the part that is really important for us to understand. So for example, the human virus that causes the common cold also circulates in bats and camels, and other ones like OC43 also have origins in cattle. And then, like I was saying, SARS and MERS, we think that they likely came originally from bats, but spilled over from bats into other intermediate hosts, and then from there into people. And then even non-human coronaviruses, such as PEDV, which is a virus that many of you have heard about that causes a lot of disease in pigs, is thought to have emerged by host switching from bats. So of course, this has really raised the interest of understanding coronaviruses. And after 2003, the amount of work done globally really started to increase. But as part of the PREDICT project, we really wanted to take a look and see what was the diversity of coronaviruses, in particular in animals, but also in people, in these low resource, low income places, because a lot of focus had been done in places like Europe, some in the US, and also some work in China, but really not in these hotspot regions that we know are important for viral emergence. So just to give you an idea of what we've done across the project is we've sampled almost 20,000 individuals. You can see the breakdown of bats, primates, rodents, and people. We do have some domestic animal samples that we've done as well. But what you can see here is by far the majority of positives were in bats, and the majority of viruses were in bats as well. While we certainly find viruses, for example, in rodents, it's really 4 or 5 that are circulating in those species. We find them in high prevalence in certain places, but really it's bats that predominantly seem to be driving this coronavirus diversity. And so what we found is a couple of things. First, we found coronaviruses across the entire tree. So this really suggests that bats are probably the evolutionary source or origin of these. And we even found them in places where previously people thought were the rodent clade or the avian clade. So they really were these precursors that seem to be really important for driving diversity. The other thing we found is when you find lots of bats, you also find lots of viruses. And we also found that certain hosts were associated with certain groups of viruses. So here, for example, what I'm going to highlight on the top are the SARS-like viruses. These are the ones we're all talking about a lot right now because, of course, SARS-1 and then current SARS-2 belongs to that. And we found that these viruses were associated with certain bat families, like rhinolophid and hippocyterid bats. And these are the small insectivorous bats that Jonna was talking about that are really important for helping with crops and as well as eating a lot of potential vectors that can cause diseases like dengue and malaria. So really, really important. So why is it important to know what viruses are associated with what hosts? What you're looking at here, again, is some of the predict data. The black dots are where we found SARS-like viruses as a part of our work. And the map that you're looking at, the heat map, is really showing the sort of where we were finding the species that we found those viruses in. So when you see red, you see many more of those species present. And you see green, we either don't know or we see fewer of those species present. And why is that important? It's important for a couple of reasons. One, because we can start to look at where the risk is to look for these viruses and where exposure might be. So of course you can see the area where this outbreak we think originated was really important in Southeast Asia, but also we're seeing spots in Africa where we have been finding SARS-2 coronaviruses. So that's important to understand where we want future efforts. We don't want to continue to be surprised. We want to be thinking about where could these viruses potentially be, have surveillance in place so we can understand what the hosts are, what's circulating, and what sort of contact people are having so we can understand the risk. So we can sort of start thinking more broadly rather than SARS-2 coronaviruses, you know, sort of start in Southeast Asia and that's where we should be looking. We don't want to be surprised and the next time actually have an outbreak begin in Africa and us not be prepared to do that. So back to sort of these coronaviruses, giving you just an idea, this shows you just sort of a snapshot of the different viruses in different groups. And you can see very, very quickly, most of them have animal origins and a really, really high proportion of them have bat origins, which is again why we think they're so important in the emergence. And again, here is the group that this current virus came from. And by far, bat viruses are the predominant hosts in this group. So again, why we really think it's important to focus there. And just to show you another relationship, Jonna mentioned the pangolin virus. So down there in the very bottom in red, what you can see is the current virus where the big arrow is that's starting this outbreak. And the next one below that is from a bat. And then below that is from a pangolin. So still, despite some interesting information from pangolins, bat really do seem to be the important source for these viruses. And again, showing you which viruses can use that receptor that we now all hear a lot about, that is allows it to have the ability to get into human cells. And again, the bat virus, most closely related to the human virus, has that ability to use the human receptor and get into human cells. So what have we been doing over the last 10 years besides looking for viruses in animals? The strategy that Predict has been using, and the reason we were able to be so successful and find so many viruses, is we don't do one test for each virus. We go really, really broadly. Our strategy is to test samples from humans, animals, and wildlife, many different sample types, swabs, feces, urine, etc., and all using the same test. So that allows us to compare across species, compare across countries, and also compare across sample types. So what we do is we do really broad screening, and we've been training laboratories to do that so that you can not just detect SARS-2, but you can detect other related viruses. And this has been really, really important. In fact, in the early parts of this outbreak, when we were first learning that there were cases leaving China, our laboratories in Thailand, Cambodia, and in Nepal were able to use our assays to be able to detect the virus in those really, really early cases before there were sequence and specific assays available. So I think the huge reach that this project has had in the end is the additional tools that have given our teams the ability to detect emerging viruses when assays do not yet exist, as well as the network of linkages between laboratories, countries, and government ministries, so that they can be out there on the forefront and be training people and giving sort of their amazing knowledge to help inform on these responses. And with that, I'm going to end and hand that over to Dr. Brian Bird, who will talk about other animal hosts.
All right, thank you, Dr. Goldstein. Very nice presentation. So what I'm going to be talking about is a little bit about how is it that these particular groups of viruses or coronaviruses are able to move around multiple species. So really looking at it from a host ecology and the virus perspective as much as we can, because we really do need to understand fundamentally, how do we go from viruses that are existing and being reservoired in bats in their natural environment, their natural ecology, causing no real harm to these reservoir animals, to our global pandemic situation. And for those of you who aren't familiar with this website, the web link is right there, called nextstrain.org, and it's a wonderful resource for tracking the virus spread human to human across the world using genetic information. So as Dr. Goldstein was talking about, coronaviruses are globally spread. They're found in a wide variety of animals. They're some of our most important and impactful veterinary medicine foes. Cattle diseases, pig diseases, chicken diseases, really hugely impactful and important veterinary diseases that cause high-level mortalities in those species. However, in our current outbreak, the COVID-19 SARS-2 coronavirus outbreak, the situation is a bit different, and it's a continually evolving understanding of which animals and which species may be involved in the transmission cycle. So as Dr. Goldstein alluded to, coronaviruses are wonderfully interesting in that they're able to infect multiple hosts as a group. If you look at these chains of transmission, just another way of looking at the relationships of the viruses to their host. And we do believe, in general, bats are the progenitor species that were the original home of coronaviruses. And in deep time, these have now evolved to fill up various ecological niches. And it's a spillover from bats or other animals into people, domesticated animals, even sea animals, marine mammals and things, birds. It's a very wide diversity of viruses. But what we're interested in right now is the COVID outbreak and the SARS coronavirus 2. So we do believe this had a bat reservoir, although that's not known for sure which exact species it is at the moment, although all the historical evidence would definitely point back towards bats as a likely source. The most closely related virus is a bat-borne virus. But are there intermediate hosts, something in between the bat and us that allowed us to get infected? And now we're learning more about the virus from human COVID patients coming out of us and infecting other animals. And what's the basis of that? So this is a little bit of virology here. I'm a molecular virologist by training, one of the many hats I wear. And something we need to realize is that for viruses to cause disease, they have to get in. They have to get into the cell, into the patient, into the animal. And generally viruses use something called a receptor molecule. And different groups or clades of coronaviruses use different receptors, but this group 2, the beta coronaviruses, the SARS viruses, use something called angiotensin converting enzyme 2, the ACE2. You've probably heard about that quite a bit. And this is a ubiquitous protein found on our cells. It's found in all animals that have been investigated, to my knowledge, because it's critical for blood pressure homeostasis. It's one of the important signaling molecules that actually keeps us alive. It keeps our blood pressure up so that we can be talking on Zoom and enjoying conversations with each other. But across species, bats to cows to pigs to cats to people, there are variations in the sequence of that molecule, and that may help inform the risk that we're looking at going down the road of which animals might be infectable by the virus. So on the left here, this is a phylogenetic tree of the ACE2 receptor. Okay, so don't pay too much attention to the fine details here, unless you're like me and interested in genomics and things, but what to look at is these categories. So you can see at the top of this particular tree, you have livestock, kind of ungulate animals, the cows, buffaloes, pigs here, horses. Then you have a group of bats, then dogs, cats, humans clustering here together, and then more distantly related rodents, then snakes, and then and quite far evolutionarily birds. Because, well, that makes sense because we're not all that closely related to birds, right? And when you think about the virus getting in, on the right side is a cartoon of a SARS coronavirus particle interacting with its receptor. And this virus receptor binding is critical for the virus to get into the cell and start to grow and do what the virus wants to do, which is to make more copies of itself. And eventually the virus has to get out. So there's this process of getting in to the cell, the virus growing, replicating, making more copies of itself, and then getting out. And it's really the getting in and the getting out is part of that's critical about causing disease, but just getting in doesn't equal disease, okay? And that's where we're at in this stage in the outbreak. We're trying to learn more and more about what can the virus do in multiple species of animals. So clearly, I mean, the virus is a reservoir in bats. So the virus can get in and get out of bats. That's very kind of obvious, I think, because they're the reservoir species, but it doesn't really cause disease. The bats have complicated immunological responses that are able to control the viral infection and not cause them any overt disease, but they're persistently infected and they shed the virus into the environment. And then, then somehow we came in contact with that here. So the virus clearly can get into us and cause disease and get out because we are now in the midst of a human-to-human transmission pandemic. But what about other animals? When you look at their ACE2 receptor, some of the first natural occurring infections that we learned about in our close contact domesticated animals, our pet animals, was in dogs. So the dog receptor molecule is fairly closely related to humans, but you know, dogs got infected, but they didn't really have any strong disease, certainly not severe disease, and really at best mild symptoms, but they were infected and they were able to make antibodies. And now we come to cats. So the cats at the ACE2 receptor level are more closely related to humans than dogs. And the cats did develop mild to moderate disease. And we know now from experimental studies, they're able to pass on the virus to other cats. But what about more distantly related animals, like livestock? So recently, experimental studies were reported where groups in Germany had tried to experimentally infect pigs. The same had been done in China. And those pigs were not infectable by the virus. They seem to be quite resistant. So that's a good sign that our livestock animals hopefully will not be susceptible to being infected in this outbreak. But of course, this could change as we get more data. Mice, so house mice, great experimental model. Those seem to be highly resistant to infection by the COVID-19 virus, the SARS-2 virus. But I've told you this very nice story. It's wonderful. It looks like the further away you are related to humans, the more likely you are to be resistant to disease. But unfortunately, that's not always the case. Biology is a system that's designed to break rules. And I'm here to say, if you look at infections of hamsters that were recently reported, those can be infected and do develop mild disease. So this isn't the complete story. Just getting into the cell isn't the whole story. It's what happens to us immunologically after we're infected. And we can see that in us as people, because a majority of people are infected, maybe develop mild disease, and then a minority develop this more severe and lethal disease. And we even have asymptomatic cases. So there's a lot of host factor genetics that are in play here to determine the outcomes of infection. And in summary of what we're aware of as of today, of what I could find through recent updates in the literature and preprint articles, this is where we're at. When we look at natural infections, so these are infections that occurred naturally in a household environment or contact between people and their animals. We know that there are dogs that have been infected. They don't seem to have very much in the way of apparent disease. House cats, so domesticated cats, are infectable and they do develop mild disease. Tigers and lions are the recent sort of surprising result from zoos here in the United States. Those felines were also infectable, likely from a caretaker that was caring for them while they themselves were asymptomatic with the disease. And now there's more and more experimental data coming. Experimental infections are useful, but somewhat artificial. So we have to take this data a bit with a grain of salt as what would happen in the natural environment. But if you infect these species of animals with relatively high doses of the virus, domesticated house cats could be infected and they could transmit it onto other cats. Non-human primates are certainly susceptible to infection. So both rhesus and cynomolgus macaques are infectable and can develop respiratory disease. Fortunately for us, and a strong indicator experimentally, animals that were infected and got sick and recovered were then resistant to re-challenge by the virus. So hopefully that means that all the vaccine efforts that we're working on right now across the globe for us, for humans, will be effective. Ferrets and hamsters were infectable, caused respiratory disease, and they could transmit the virus on. And fortunately, thus far, our livestock animals, chickens, ducks, and swine are resistant to infection. As Dr. Goldstein alluded to, there have been some speculations about other wildlife being involved, like pangolins or ant bears, as they're known in West Africa, and snakes as being perhaps the originator of this outbreak. And a lot of that work was done based on sequence gazing, or looking at genomic information that may be important in looking at the relationships of viruses. But just because you're closely associated with something doesn't mean you caused the thing. And I think that's quite clear now for the pangolin and the snake story. These were not the animals that were actually causing the disease outbreak in humans in China. From other animals, there are major conservation risks that we need to be mindful of for non-human primates, endangered species across Africa and Asia. We certainly know macaques are infectable. These are widely spread throughout Africa. Gorillas, orangutans, and chimpanzees are also very likely to be infected, and they may develop respiratory disease. We don't know at this time if any have been infected. But that is definitely something we need to think about for ecotourism. And right now, there are strong recommendations from the World Health Organization, Centers for Disease Control, AVMA, and other groups that sick persons and their contacts should avoid contact with their household pets and domesticated animals, and of course, non-human primates. And this is just as an abundance of caution, because we know now it is possible to spread the virus on. What we don't know yet is, can that virus come back to us from our domesticated cats? It seems unlikely to me, and I doubt it would be epidemiologically relevant, but it's something we should be thoughtful and mindful of as we go forward. My last slide is just links of different resources that you might want to check out that have some of this data and some of the references that back up the slides that I showed before. So with that, I'll turn it back and stop my screen share. Thank you. Thank you very much. So now we're turning it over to Dr. Johnson. She's going to give us an update on her work.
Thank you, Dr. Brian Bird. What a great discussion. And I think it's so interesting to see how much this pathogen has roots in evolution across multiple species. And I think that's one thing we wanted to just share with you all briefly, is how much we think that the COVID-19 pandemic is a One Health issue. We did not really get very much caught by surprise with this pandemic. As Jonna's been saying, many of us have been working in pandemic preparedness for many years, and we really spend a lot of time thinking about the underlying drivers, and it even goes further from cross-species transmission and the potential for us to share viruses with animals. We really also like to try to understand the influence of environmental change and how much biodiversity and species richness in some areas that are rapidly undergoing landscape change, how that influences disease epidemics. And we think that a lot of the pandemics are oftentimes unnoticed, and their spillover, spillover events are unnoticed. And it's only after a lot of people get infected that we start to notice an outbreak. And it's an extremely rare event that we have the situation we're in right now, where this is a pandemic. But we do worry that these things are going to be increasingly common because of the situation where we have a lot of landscape change and a lot more interaction with animals, especially wildlife. And we're also, of course, much more globally connected. And so once an outbreak occurs somewhere, it's likely to occur anywhere. And I think that's one thing that's going to be very much present as we move through the epidemic situation in the US, and we start to see some of our colleagues in the rest of the world grapple with this, we're going to really, I think, start to recognize the importance of the One Health approach and how much our health and everyone else's health is all very intertwined. So looking at environmental drivers does really help us, I think, in trying to understand what we can do to head off pandemics in the future, especially given the amount of landscape change that's currently underway on our planet. And we are doing work to try to understand specific situations that increase the probability of spillover risk. And as our colleagues have already discussed, we know we've got close relationships with some species, but also we know some are more likely to be the source. And definitely when we look at all the viruses, bats are ranking very high, as well as primates, in terms of the likelihood that that we might get a virus from them. But I think importantly, it's really how we're handling and interacting with species that are important. And we've shown that there's certainly high levels of risk associated with changes in habitat quality that affect species and influence species distributions. And there's also obviously the very close contact that comes with hunting and wild animal trade and trafficking that we've shown are much more likely to increase the risk of spillover. And the work that we've been doing with PREDICT over the last 10 years, as Dr. Mazet was indicating, has really highlighted that. And so we've looked at RNA viruses with pandemic potential and really shown how these wildlife-human interfaces pose a higher risk in terms of us just having found more RNA viruses in these situations. And so these markets where animals are traded are really important in the wildlife-human interaction. There is sort of an active sort of pathway for diseases to emerge because of the level of contact. And that's something that we're very excited to tackle in this next little mini phase of PREDICT. We have 6 months to work with colleagues around the world in Africa and Asia to be able to investigate the potential reservoirs for SARS and look for early spillover and see, especially in the Asia region, if there was some indication that this virus might have been transmitted to humans from animals and not been actually human to human yet, or at least caused an epidemic at the size that would be noticed. And we're also working very actively in these wildlife markets to try to characterize risk in those situations as well. And so just getting away from those ecosystem drivers, now that we're in a pandemic, I think we're all mostly interested and very focused on how do we get out. And I think this is where we just don't have a lot of answers. And I wanted to try to pull together some of the best resources that I've seen in projections, and the modeling that's been informing our government has been mostly coming from this group at the Institute for Health Metrics and Evaluation. There's been other really excellent global models that were used that came out of the UK that were super helpful in us understanding that this epidemic is about to be pandemic, and sort of the potential for human suffering that could be if we didn't do anything. And I think that motivated a lot of governments around the world, but this group has been the one that's been primarily modeling and informing the US. And they've got some great sources up there. And this NPR coronavirus crisis daily update has been the most useful I've found to see. And this is just projecting with all the different states' epidemics, sort of where we're at with California, which is this very flat dotted line. As Dr. Jonna Mazet was saying, this is because we started social distancing early, and we're definitely benefiting from that. And that's all the evidence we have to date. I think you can compare our curve or lack thereof to these other states where things were implemented later, and you can see kind of where we're expected to have a peak, which I think is really helpful for us to know what to expect and how long we're going to start to see really tragic news coming in. But I think it's important to emphasize that those of us who do not get infected are then still susceptible. So I think the exit strategy is still sort of underway in terms of us understanding when we'll be able to start to engage each other and work together. And this is a really good site in that you can select a state and take a deep dive into the modeling projections that way. And so I just want to provide those resources over to you all, and I'm going to hand it off to Dr. Jeff Roberts, who's going to take us through the very exciting work that they're doing.
Thank you, Christina. Yeah, I'll go ahead and share my screen here. And well, we're going to go from a global perspective to a very local perspective. And I just want to update you quickly about some of the research going on out at the Primate Center and the steps that we're taking to protect both the animals and caregivers out here. For those of you not familiar with the Primate Center, we're located out here on the west end of the Davis campus. That's Hutchinson and Road 98. This is our main building campus, but here you can see there's 24 half-acre cages with about 100 to 150 rhesus macaques located in each enclosure. So we have about 4,000 non-human primates out here, about 300 employees. And just one note, our sort of response and our view towards COVID-19 is in part influenced by the fact that in 1987, we had a measles outbreak that was introduced into our colony from local populace, and that resulted in significant morbidity and mortality with a very significant disruption in research. So in February, as we were watching the cases in the United States, when we had on the 27th, the first person-to-person case identified in Solano County, and that patient was later transferred to UC Davis Med Center, we discussed it, and immediately on March 4th, I had a decision to restrict access to animal areas to full-time staff and paid students. We have a lot of students being part of the university from the vet school, psychology department, other areas on campus coming out here, and we shut that down just to reduce the overall numbers. We have a very active preventive health program, but we temporarily halted physical exams, animal moves, and outdoor roundup, which is pictured here, just trying to limit human to animal contact. At the same time, in the next few weeks, we proceeded with a reduction of research activity and staffing. We basically decided not to initiate any new research projects, except, as you'll see, those related to COVID-19, and continued with ongoing projects when possible. We have about 700 pregnant rhesus out here right now, and a lot of investigators will work with them in nurseries because of the extensive or intensive use of PPE. We discontinued that, and we approached our reduction in activity with the goal of a 50% reduction in research and animal care staff actually being out here on site. The next aspect was to establish a barrier colony to maintain seronegative animals for COVID-19 research. We weren't sure if the virus would get into our population, but we've taken 80 animals and we're putting them in a barrier facility with the highest level of controlled access to try and maintain them seronegative. Immediately begin monitoring all respiratory disease cases in our colony and stopping all discharges from our primate medicine hospital. Our immediate goal was to proceed with animal testing and colony surveillance and developing both antibody and viral testing for SARS-2. And the primate assay laboratory here with Joanne Yee has been working with other primate centers, working with Tracy at the One Health Institute, the COVID working group, and we've been able to get started with a commercial COVID assay specifically for non-human primates, looking at our respiratory cases, discharges, and animals entering the barrier colony. So far, we've screened 60 animals with antibody, 41 with PCR, and all have been negative. We've initiated a sentinel program with testing of all hospital admissions or animals immobilized for physical exam to be able to monitor our colony. As far as the research side, that began immediately with a collaboration between the Center for Immunology and Infectious Disease, which is right next door, the Primate Center, and the Medical Center. And we're fortunate that at the CIID, there's a BSL-3 laboratory. And here on the left-hand side, you can see two of the workers in there receiving the human isolate sample from the Medical Center to start propagating the virus in their laboratory. We then sent that virus back to the clinical pathology laboratory at the Med Center for assay development. And there's just been an incredible collaboration between these various groups. And we are also gearing up for the biosafety, animal biosafety level 3 facility in our virology and immunology laboratory here to begin experiments on non-human primates in the first week of May. And I'd just like to say a note that the collaboration, not only here on the Davis campus, but really nationwide in addressing, SARS-2 issue has been amazing. It's almost like it's a national Manhattan project for biology. And it's just amazing to see the interaction between all these different institutions, both academic and private sector. Anyway, to round out what we're proposing to do, right now our BSL-3 suite has a limitation of 8 animals. We're training up staff to be able to start those experiments in May, working on processes of to inactivate the virus so we can distribute samples to other laboratories, working on our RT-PCR to be able to assess viral load, which will be one of the important endpoints. And of course, with infected animals, taking samples, nasal, tracheal samples, blood samples, and radiographs to assess clinical condition. And although there is certainly an interest and we have a lot of proposals to look at vaccine, right now we're responding really to the healthcare community, and that is looking at what can they do in the clinic right now. And so there's a big focus on the use of convalescent serum, possibly playing a role in evaluating the hydroxychloroquine treatment and other novel therapies. But all those proposals actually for use of this limited animal facility are going to be reviewed by a committee chaired by Dr. John Morrison, head of the Primate Center, and Dr. Stephen McSorley, head of CIID. Right now, our big bottleneck is PAPRs, personal air purifying respirators, or powered air respirators. And we only have a limited supply of the disposables for those. So right now we're limited to a 14-day study. We've actually contacted UCOP, and they're looking at system-wide if there are units available. Obviously, the first priority is a healthcare setting, but we're trying to get enough units together so that we can continue other research projects. Some of the things we're looking at, obviously infections in young versus age, interaction with private sector companies are coming up with novel therapeutics, and then initiation with vaccine trials. And finally, we'd like to initiate human testing of our staff doing sanitation with direct animal contact. So I will finish and turn over to Trina.
Thanks, Jeff. That was great. I'm going to go ahead and try and share my screen here. Okay, so I have the last set of slides. It should go pretty quick. We want to make sure we have time for Q&A, but hopefully this will help to just perhaps motivate and inspire some of you to really keep doing what you're doing, right? We want to build a One Health approach in our workforce. And the slides that I have and the work that I've been doing are trying to make progress largely on the international front. You can see on the left our One Health Workforce Next Generation kickoff meeting last fall, which is helping us to really work with many of the same countries that we've had as colleagues and partners and predict for the past 10 years, but really give a primary focus on training, both university level training, on the job training, and perhaps even pre-service training. So we are working with many countries in Africa and Southeast Asia, and in fact had some discussions with them live this morning and last night about what's happening around COVID-19 and their activities. So that is an exciting area where the vet school is quite involved, but I also want to just have that reminder that really global health is local also. And the Knight's Landing picture that you can see on the right there is something that is just really inspirational from my perspective, seeing how we're working across sectors to improve healthcare delivery and the idea of understanding diseases that address human and animal issues locally, and really thinking about what are the underserved communities that we can help with wherever we are around the world, I think is really important. So the One Health Workforce Next Generation project certainly has many partners. You can see some of those logos across the bottom, but I just want to share a couple thoughts with everyone on what's happening in case you'd like to get more involved and so that you're aware of some of these ideas. So as you heard Jonna mention earlier on, we've done a lot of work around the world trying to improve awareness and build competencies with a One Health approach in over 30 countries, Africa, Southeast Asia, previously Latin America as well, really with this mindset of we want to think globally, but act locally. And if we all do that, we might really make a difference. So over 6,800 folks were trained as part of that project, and we're now transitioning into this One Health Workforce Next Generation kind of sister project and trying to carry on many of those partnerships to really improve preparedness, improve surveillance capabilities, get involved with response where we can to support the local governments and partners and carry on from there. So one of the exciting things that's come forward probably more quickly than I expected, given the shelter in place and the remote work situation we find ourselves in now, are these virtual communities of practice, right? So as part of the AFRIHUN, meaning the Africa One Health University Networks, and the SIAHUN, Southeast Asia One Health University Network partnerships, we've launched these One Health virtual communities of practice where we bring folks together live online in a Zoom session, largely like what we're doing right now, and they can share experiences. And you can see from those maps on the right, we had over 900 participants in our launch of that, which was in late March, and we are continuing those now every 2 weeks. So those are open to anybody, and if folks who are participating in today's Zoom session would like to be involved, certainly we can provide more information on how to join in. But it is very cool to hear real time from colleagues. This morning it was from Tanzania and Sierra Leone as some of the featured presenters. Last night it was Vietnam and Myanmar. So there's a lot of really great work, and it's all working because people are collegial and collaborative and they want to really solve problems. So to me, that's the reason that we should all really keep doing what we're doing and make a difference wherever you can. If you would be interested in staying involved with those ideas, every 2 weeks we are doing these Zoom sessions, one on the Africa time zone, one on the Southeast Asia time zone. And so we can put the link for the website in the chat box for you, but they are offered in English and French. And we had community surveillance as our topic today, but we will be moving on for new topics related to COVID-19 and outbreak ideas over the next few months. So that is an ongoing way that many of you could stay involved. If you'd like to hear about what's going on or share your experiences, that is a way to do that. I'm really excited to see a lot of the regional and international leadership that's emerging as part of the COVID-19 outbreak. This is just a quick example of one of the pieces that's come out recently from Africa CDC and the African Union, trying to tailor and get the messages out about best practices around social distancing, around COVID-19 ideas. And they also did a nice job in this one, not just making recommendations, which you can see on the right, very important to try and get the word out about good hygiene, all of those different pieces, but also recognizing that there are some really tough questions that we don't know the answers to, not just about the biology, but really about the social sciences aspects of these issues. So whether it's how to really be effective and realistic in doing social distancing and the recommendations in the context of the local communities, that's really tricky. And so I just want to commend some of the groups that are trying to take on those really difficult and complex topics using a One Health approach and thinking about what can we do to really improve the health of people, animals, and our shared environments. And then the last thing I wanted to mention, and Tanzania is an interesting example because it's perhaps not doing what I had on my previous slide. They have not yet embraced social distancing and in fact have had some very interesting messages coming out about congregating to pray for COVID to go away instead of actually doing social distancing. So hopefully that messaging will shift soon. But prior to their current leadership, we had seen a lot of good work happening in many countries around the world with this idea of having cross-sectoral One Health platforms emerge. So a government-based entity that works across the different divisions to be able to recognize the need for collaboration. And this is something that I put up Tanzania as an example because they did a nice job in recognizing the strength of working together, working across sectors to try and break down some of the siloed thinking and the siloed work that happens in so many places, including our own setting. Thinking about sharing resources, sharing ideas, and so really looking at how can we better connect for an integrated approach to outbreak preparedness and response. So I think perhaps we could make some progress in doing this better in the US. We don't really have a government platform that takes that on at the state or the national level to the extent that we probably should. So we may be learning from our partners around the world on what's working for them. But I think it is a really interesting and important idea of how do we have an integrated approach and do it in a very collaborative fashion to the extent possible. And the last idea I want to leave you with is just to remember that people matter. All of you matter. And so these folks that you see in these pictures are our colleagues around the world who have been trained as part of working with us, but we're learning from them as well. And they are really emerging as leaders that originally may have come to us as part of working on specific projects, but now have been elevated into leadership positions as part of the COVID-19 outbreak. In Rwanda, for Julius on the left, Supaporn in Thailand, and James in Sierra Leone are all really good examples of leadership and role models for the local communities and emerging scientists as we try to build a One Health workforce. So I'm going to go ahead and stop there in the interest of transitioning us to the question and answer session. And I think we'll kick that off. Let me stop my share here. By going to one of the questions that has come up in a few different ways. And I want to just be able to go over to ask Jane Sykes if she would like to share any further comments related to the importance and the messaging around the cat-human interaction, potential transmission in both ways. I know that that's something that you've been giving a lot of thought. So I'd like to give you the floor for a moment if you would like to share anything further.
Yeah, thanks very much, Trina. Can you hear me?
Yep, you sound good.
Great, thank you. So yeah, obviously a lot of concern and maybe the possibility of pets becoming infected, and Brian commented on that nicely as well in his talk. And I think there's been many people jumping to conclusions that are somewhat unfounded based on, in particular, the experimental infection paper that was published in Science yesterday, whereby ferrets and domestic cats and a very small number of dogs were infected, and exposed, at least one exposed cat. It wasn't actually clear from the paper whether there were one or two exposed cats and exposed dogs. They concluded in that paper that cats could be, domestics could be infected and that they could transmit the infection back to other cats. They didn't observe that in the small number of 3-month-old dogs that were in the study. But so far, although there's been 1 or 2 reported cats that have been infected in the field, we have one that may have had clinical signs suggestive of COVID in Belgium, and one cat in Hong Kong that was tested was subclinically injured. Those are the 2 cat examples that are out there. And then we've got a couple of dog examples of subclinical infections, and they were both in Hong Kong in quarantine that had come over positive households. But what a lot of the time is not spoken about is all of the negative cases. And so in the Hong Kong quarantine situation, they've got about 30 dogs and almost 20 cats that they've taken into quarantine from COVID positive households, and only those 2 dogs and that 1 cat have tested positive. NIAX claims that they have run thousands of samples over a 1-month time period from mid-February through to mid-March from dogs, cats and horses, where samples were submitted for respiratory disease testing, and that they tested all of those for SARS coronavirus 2, and not one so far positive result has been obtained. So I think it's really important not to jump to conclusions that an experimental infection study is representative, as Brian said, of what actually goes on in. And so far we have absolutely no evidence of transmission of infection from pets back to humans, and public health officials worldwide are emphasizing emphatically that this infection is driven by human-to-human transmission and not from pets to humans. We're still learning about disease, and it's important that we continue to try to understand the epidemiology as it relates to pets, but so far not good evidence that they represent any source of infection for people, either as fomites or shedders.
Thanks so much, Jane. Yeah, I think Jonna, over to you.
Okay. We have some questions in the chat around California specifically, what strains and what differences we might be seeing in California. Did potentially we have introductions earlier? There's a lot of tourism in California between Asia and California, as most of us know. And there was also a very strange and early flu season, which may not have been influenza. So there are a lot of rumors around that and some work going on. And Stanford is doing work specifically to look at that, but they are developing and using serology more prospectively than retrospectively. Certainly there are influenza samples from earlier on in the fall that were collected for a different reason that might be able to be used to look at some of this, as well as blood banks and others. But right now, the big push is really to figure out how to limit spread, and all the resources really need to go prospectively into human-to-human contact. So while there may have been introductions that we don't know about, the likelihood is not huge that California has herd immunity because we saw something the same or similar earlier than maybe other places saw it. Much more likely right now is that we have been experiencing a reduction in cases because we have been very compliant and we went into a sheltering situation earlier than many other locations did. So I'd like to just sort of say I'm never going to be dogmatic, and I don't think we know, but we don't have great serologic tests yet. That's been a big discussion with that National Academies Committee that I mentioned, that currently the serologic tests that are being developed and optimized, some of them are better than others, some of them trade off better sensitivity for less specificity, and some the other way. And those are all fine trade-offs, but then you have to use those tools as they were designed to optimize your results, depending on what kind of surveillance you want to do. And that's just not being done, except in a very research early phase right now. We do need that, and that's going to help us with a lot of questions about our how widespread our exposure has been, and potentially how widespread, if immunity is conferred, how widespread that immunity is. In addition, the questions have been around what about the strain in California? And I think while I'm talking about this, Dr. Bird will share his screen. He can put up a nice visualization of the California versus New York strain. I think primarily what people are pointing to as the differences between California and New York is that multiple strains were introduced into New York, probably at not too distant times. Certainly the European strain that has been introduced into New York is being questioned as to whether or not that might be a more lethal strain or a more problematic strain than we're seeing in California, which looks to be, most of our cases look to be coming from the Washington strain. Now, if you really look at the numbers, there's really no difference as far as mortality. We are seeing the same levels of mortality as they're seeing in New York. We're just seeing less cases. And so again, that's primarily likely to be much more due to our behavior here. As far as we went into sheltering a bit earlier in our disease curve, and we may be more compliant with that sheltering than other places. In addition, our cities are quite different, and our people are spread out more. So people are comparing the whole population of California to the whole population of New York, but New York is much, much more concentrated around New York City and the boroughs. So, so that's a big piece. You can follow these strains on nextstrain.org. And you can follow those in real time. You can also, I think it's important to understand that there are multiple strains, but they are all very, very similar. So I think as of the end of March, there were only 11 base pair substitutions differences around all the strains that we're tracking. So the strains help us to identify where and how things are moving, but the virus isn't very different, and it doesn't appear to be changing its virulence or pathogenicity with these small changes. I don't know, Brian, do you want to just say anything about what you have up? And then I think we'll hand it to Tracy also for a comment.
Sure, thanks, Jonna. Yeah, so for folks that aren't aware, this is the nextstrain.org site, and this is all the publicly available genomic sequences that are available. And you can sort them by countries and states and county level even. And I just wanted to show, you know, the yellow dots here are California patient specimens that have been sequenced, and the blues here I've just selected, these are the ones from New York. And I think a critical thing, as Dr. Mazet said, is that our California strains that are circulating now in our patient population are right in amongst those from New York. And as she rightfully stated, it doesn't look like there's, while each virus is slightly different than the other, collectively they are not evolving to enhance virulence that we can see so far in any location. They're just doing their normal viral thing where viruses slowly evolve over time. So that's all for there. All right, I'll stop my share now.
Yeah, thanks, Brian. I think I was going to say something similar. There were two comments I wanted to add. One is both of you are exactly correct. The virus is really not mutating. And one of the reasons probably is there's just no pressure on it. You know, we don't have a treatment, we don't have a vaccine, and we have a lot of susceptible people because SARS, like coronaviruses, have not circulated widely. And those are usually the things that have viruses, you know, sort of put a pressure on viruses to change drastically. The other thing I want to say, there's been some question about sort of what do we know about entry into California and other places. And I think a lot of that is retrospective data that we're learning later on, but just some information that some of you may not be aware coming out of China was that this virus, for example, based on evolutionary analysis, shows it probably mutated back in October. And it wasn't really until December that, you know, in China, we really knew that there was a problem. And then in January and in early February was when we first started to see some cases show up, some students that had left China to return home to Cambodia, Thailand, and other places. That was the first time we really realized that the virus was moving. So I think that, you know, at the end of this outbreak, we might be able to go back and estimate things about, you know, when things actually were circulating. But likely with a virus like this, it was circulating for much longer than what we realized. And in part, it's sort of, you know, the perfect virus, right? It doesn't kill the majority of people, thank goodness. It does obviously kill a lot, but not the majority. And what happens is many of us can be infected with mild illness and not even always know that we're infected. And that is why this has been so successful and so difficult for us to track. I did want to add, unless Jonna had a comment, I was going to see if Jeff was willing to take one of the questions.
Certainly.
Jeff, there's been a question about sort of what PPE would you suggest zoos with animals like macaques and also felids, sort of what's the minimum PPE that you feel that these facilities should be using when they're handling the animals?
Well, I guess it depends on the institution and what their PPE requirements already are in working with, non-human primate species in a zoo. And certainly I don't think they'd have the same level of thing with cats, but, I would encourage to have, if you have access to N95s or other masks, that would be ideal, but we recognize that a lot of those supplies are all being diverted to the human healthcare setting, which they should be. I mean, you can't argue that. The people on the front lines there. So cloth masks, whatever you can do to prevent exposure of your captive populations from asymptomatic carrier. It's interesting in terms of host susceptibility. So far, the macaques that have been infected, both rhesus and cynos, haven't gotten that sick. Clinically, they look pretty normal. You can see radiographic changes of pneumonia, other indications. They tried infecting marmosets. Marmosets can't get infected. Marmosets appear to be unaffected by exposure to the virus, which for anybody who's worked with marmosets is unusual because they're very susceptible to a lot of other agents. But at a minimum, cloth masks, some sort of facial wear in working around those animals, and just limit contact of people to those animals until we understand more about the biology of the virus.
Thanks. I think I'd like to turn to a question about the curve. So of course we've been talking about social distancing, or what we're being asked to now say physical distancing, because they want us all to be social so we don't feel isolated. So social by this kind of process rather than in physical contact. But what does that mean for the curve? When will it peak? Some of the models, as Dr. Johnson already mentioned, said that it might peak as early as this week or next week. Others now, I think, are changing their thoughts around that and recognizing that one of the main reasons that we do have a fairly flat curve here compared to other places is because of our commitment to sheltering in place, and that may delay the peak of our curve until when we sort of stop sheltering as much, and how we're going to deal with that. So I guess I'd like to turn to you, Chris, to see if you'd like to make some more comments on the evolving nature of our projections.
Yeah, thank you, Jonna. And I see there's a lot of questions trying to still unravel how so many people get infected at one time, which is certainly, as I think we've already addressed in a few ways, not that surprising given what we know about the way the pathogen is shed, and even with, the 6 feet social distance or physical distance that we're doing, there's of course the potential for contamination of services, and that is probably a really important way that these things are infecting a high number of people at one time in different situations, as we've seen reported. I think it's really important to emphasize that this is a brand new virus to science. We're still learning so much about it. It's such an active area of research. It's been amazing seeing almost all infectious disease researchers just completely pivot to understand what to expect. And I mean, it's just only been 4 months, which is not really enough time for us to really get a good idea of what to expect as far as epidemic curves, and whether seasonality or changes in seasons in the weather could affect the likelihood that this epidemic curve will be affected by that. And then also I did just want to do a quick shout out to Dr. Bart Weimer, who does have a really very poignant paper on a preprint serve. that talks about some of the genome identity and some of the molecular epidemiology and what we might expect from pandemic dynamics. So it's been amazing to see our colleagues just pitching in and sort of trying to work on projections of what to expect almost on a real-time basis. But I think to Jonna's, really urgent and kind of relevant question, what do we expect with probably a lot of us who have really flattened our curve right down? We know that we're still susceptible, and unfortunately this is a novel virus, so none of us have immunity until we're able to get vaccinated, and there's so much complexity around disease dynamics, and it has everything to do with the density of people and our contact rate and the size of the population, and that's all really baked into these models. But we do know that the only way you come out of those epidemic curves is by having the population be immune, and that can either be from getting the disease or getting a vaccination. So it's unclear. I think two things. One is it's unclear even when you are exposed to this virus and infected, how long that immunity will last. I've seen some really well-respected scientists go on record saying it might only be 2 to 3 years before immunity wanes in the population, which is what's seen with some of the other coronaviruses, which is why they always circulate seasonally in the population. And so if we're going to be in a situation like that, we do really need to pin a lot of our hopes on the vaccine. And so as long as it takes for the vaccine to come around, that really dictates what we need to do in terms of physical distance, because as soon as we start moving again, we can spark another epidemic curve that is, if not the same size, it could be even bigger, as we were saying. So we're safe while we're implementing these measures, but there's the potential for the outbreak to restart as soon as people start engaging. So I'm hoping a new area of work that we can start to contribute to is how can we get back to work? How can we start to re-engage in doing this in a very smart way so we don't trigger an epidemic? So that's another area of work that I think is going to be really interesting and yeah, part of hopefully very relevant to the world we find ourselves in now.
Yeah, I think thanks very much, Chris. And I think that a big cluster, if you will, of questions that are coming in now are just kind of riffing on some of these questions. So we'll follow up briefly, and some of those are around what about masks and droplets. So certainly Donna Lairmore and others have asked about the corral group that all got infected. I think just before that we were definitely recommending masks to protect others. So to keep your own spit in your own mouth in case you're or around your face in case you're an asymptomatic carrier or only having mild symptoms. And that is a best practice that is being used widely in Asia and is also being considered, like physical distancing, to be working. And it certainly doesn't hurt unless you have restricted breathing or other issues. And as long as you're not using those N95 masks or other masks that our healthcare workers need so desperately, as Dr. Roberts mentioned. So certainly using the mask, preventing droplets, it doesn't hurt and it can help. Studies are showing that actually we're finding SARS-2 coronaviruses even making it outside of the hospital rooms of people who are being intubated, which is definitely a higher risk, aerosolizing droplets, moving droplets, but finding the virus more than 18 feet outside of those hospital rooms indicates that we need to go a bit more stringent than 6 feet and no masks. So I think that can help as well. The other questions around California's special sauce may have more to do with a few other things that we haven't even mentioned yet. That certainly people in certain areas may be more physically fit, may be more healthy. We may have more One Health aspects here at play than we know, but we can't be complacent. This virus is highly infectious, and some sectors, everybody's vulnerable, and some sectors are especially vulnerable to very devastating consequences. So we need to protect our friends and family members and anybody with comorbidities. And I hope we'll understand even more some of the risk factors that we're just starting to tease out now, especially those that cause some young people to have really severe consequences. So with that, we're coming towards the end. We have a bunch of really technical viral questions that probably about maybe 20 to 30% of us on this chat would be super interested in, but not necessarily everybody for the last 5 minutes. Might make some of our heads explode. So we're going to let Brian and Tracy and others take some of those questions offline, and we'll try to get you some answers. And we've been trying to put up some FAQs to the kinds of questions that we've been getting. We've been doing, as Dr. Smith mentioned, we've been doing educational outreach and collaborative communities of practice with colleagues all over the world. Dr. Goldstein mentioned that as well from the lab side, but also from the academic connection side. We just did 2, some of us last night and this morning early, with Southeast Asia and Africa. So we have a lot of frequently asked questions through all of these platforms, and we're trying to get those answers out to you all. Before we wrap up, I'll turn it back over, and I want to thank our wonderful One Health Institute and Dean's Office communications teams that have helped us with this. Tom Hines, Jenny Lane, Zoe Grange, Amy Bond, many folks working behind the scenes, Matt Blake, making this all work. And I'll turn it to Jenny in case there's one or probably just one more question that we could take, or we can wrap up.
I think probably now is a good time to wrap up, but I just wanted to point out we put the link to our frequently asked questions page that we keep regularly updated on our website in the chat box, and we will be following up with everybody who attended the town hall with a kind of summary, take-home points and messages, along with adding some of the answers to the more technical questions to our fact page. And just appreciate everyone signing in. And I think at my last count, my highest count I saw was 392 participants. So back to you, Jonna.
Yeah, well, thank you again. I think we tried to highlight some of the activities at the California National Primate Center, Primate Research Center, sorry, butchering it, been up too long, and the One Health Institute. But as we heard from the Dean and Chris and others, there's just such amazing work going on at the school. Thank you, Jane, for weighing in on the pet question. We have wonderful zoo veterinarians who can also weigh in future town halls if you'd like to have that, or have offline questions. And I'm just so proud of our whole vet school community, those of you who've really rapidly adapted to teaching and mentoring online. And I hope that you all are staying well and taking breaks and going outside with a distance and enjoying nature, because we are going to be in this for some time. And it's likely that we'll be on and off sheltering, trying to protect ourselves and our communities for some time to come. I wouldn't be surprised, and the governor's office is saying this as well, that we'll be asked to continue this potentially past the end of April into May, maybe even June, or we might see some staggering of requests of groups that go back to work. So having some of the more critical economic infrastructure employees going back to work who can't work from home, and asking folks, and it's been specifically mentioned, like academics who can often do more from home, obviously not your labs, to stay home and continue to work from home, which is, of course, a stressor for everyone. But if you are having a more intense and intimate time with family members, please take the time to figure out how to take breaks and enjoy each other, play games, do puzzles, you know, take the stress off. Maybe don't watch CNN constantly if you can take a break from that. And those of you who are in single person households, I hope you have your furry friends and to give you some cuddles. But even if you don't, please reach out to us, your colleagues, your friends, your family members, and stay connected. We can do this, we can get through it, and we really appreciate all that you're doing. Stay well.
Thanks, everyone. Have a good day.
Thank you. You too.
Bye-bye, everybody.